a goal! It's a hat-trick for Wayne Rooney!
Besides being a famous footballer, Wayne Rooney also made headlines when he announced that he had undergone a hair transplant to have his receding hairline restored. Just like Rooney, many people around the world have to deal with the problem of hair loss, most commonly manifested as baldness. Baldness typically refers to excessive hair loss from your scalp. Hereditary hair loss with age is the most common cause of baldness. Some people prefer to let their baldness run its course untreated and unhidden. Others may cover it up with hairstyles, makeup, hats, or scarves. And still, others choose one of the treatments available to prevent further hair loss and to restore growth. Balding is a natural process that occurs in humans. It is most common in males, but also occurs in females at times. And to some people, it makes them feel uncomfortable. Thus, they need to look for options to replace their fallen hair. Now, a couple of doctors here in Uganda are doing hair transplant surgeries to help those suffering with that problem. Unity Skin Clinic in Kampala is one of the 3 health facilities in Africa that carry out hair transplants and replacement, the others being in South Africa and Kenya. It is here that we interacted with a trichologist, Dr. Haruna Nsubuga, to help us understand more about hair loss. Dr. Nsubuga says that hair loss can be described as thinning, where one's hair can no longer grow in its original quantity, or alopecia, where one's hair cannot grow at all.
If probably you have a generation that maybe your father or your grandfather, some people may not actually get to see that history of hair loss within their family, but usually may run genetically within their family and they end up losing hair. So, and the same as well can happen to the female. What we call the female pattern hair loss, it can also be best because of the hormones. But though for the female it's way too unique, it might start with the crown and center. What we usually call the crown. It's very, very specific when it's hormonal. For female, it's quite easy to take. Though for the male, it may start off for the front and then go on, or it may start from the center as well.
Hair loss can appear in many different ways, depending on what is causing it. It can come on suddenly or gradually and affect just your scalp or your whole body. Some types of hair loss are temporary and others are permanent.
We have scarring alopecia and non-scarring alopecias, or scarring hair losses and non-scarring hair losses. So the treatments may get to differ depending on what is causing the hair loss.
Most people normally shed 50 to 100 hairs a day. This usually does not cause noticeable thinning of scalp hair because new hair is growing in at the same time. Hair loss occurs when this cycle of hair growth and shedding is disrupted or the hair follicle is destroyed and replaced with a scar tissue. Hormonal changes, family history, medical conditions are some of the known causes of hair loss.
And other causes may be due to drugs you're taking. We've seen cancer patients losing hair because of the drugs they're on. And other factors may be related to stress. Okay, this is very common in female. Also stressing periods like pregnancy, they may end up losing their hair during pregnancy or any other stress in your body, because during a process of stress your body releases certain kind of like hormones, okay, usually steroids, and you end up losing your hair. So that stress period may get to cause hair loss or thinning as well. And we have looked at also practices. This is very common in hair practices, very common in female. Women ending up with hair loss, mostly on the front, because of the methods they're using, like plaiting. These are very common because many cases we get to see of female coming in with hair loss. It's because of, the plaiting methods or the chemicals they may get to use in their hair. So those practices may as well contribute to the hair loss.
Common infections too can damage the hair follicles, thus affecting their growth.
The commonest people in layman, they call the ringworm. Okay, where you're affected and you come up with a fungal infection within your scalp, and then it ends up as well affecting the hair. Okay, most of those are very easy to treat. We usually treat the cause, but it's also counted within hair loss. There are other infections which could be viral as well. You have a viral infection within your scalp as well and you end up with hair loss. Bacterial infections, okay, where you end up with an infection of the follicles itself.
There are a number of risk factors that can trigger hair thinning and hair loss. These include poor nutrition and autoimmune illnesses like lupus.
We have also seen injuries, like maybe burns if you're burned, other injuries, you've been through an accident, you may get to lose hair. So all those are physical factors.
Before pursuing hair loss treatment, Dr. Nsubuga advises that you talk with your doctor about the cause of the hair loss and the best treatment options.
So many times, if you're to come in for a consultation, we look at the whole list of the drugs that you're taking and the illnesses that you've suffered from.
Dr. Nsubuga says though the patient ratio between males and females may be even, more females prefer to undergo treatment. The treatment comes in many different forms.
Because at times the male are actually more confident with their bald than the females.
And if you are completely bald, then a hair transplant is recommended.
If the hair is only thinning, okay, we have different treatments. And those treatments may call for medications in tablet forms, okay, supplements that we may get to put you on. And these may be either topical supplements that you only apply in your hair or oral medications that you have to take. But we might as well, if we want to quicken the process of regrowth of the hair, do what we call a PRP. A PRP is a platelet-rich plasma. We draw your blood and then we use this blood and actually do microneedles within those follicles and reintroduce the platelets to repair.
During a transplant, hair is picked from the back of your head and planted to a part without hair.
We pick it from the back simply because the follicles at the back are more resistant. We will find that many times when people are losing hair, okay, if it's more so if people are balding like male and female, it's usually the front hair that is lost and the one in the center. It is very hard to lose the hair here in that area. The whole reason is the follicles here are naturally resistant to the hormone, whatever factor, they are more resistant. You won't easily lose them. So we use those as a donor. And once we transplant those and put them in the area that you've lost, it's usually permanent.
All these processes are painless according to Dr. Nsubuga. And once completed, you are advised to go for review for the next 6 months. And for better results, you will have to follow a number of doctor's orders, including protecting your head.
The first 3 days are usually crucial, okay? Where we lessen the amount of activities you'll be doing. We will tell you not to do exercises, the way you sleep in your bed, because you're trying to protect the area that we've transplanted, not to touch that area, not to comb it, not to shower that area, or wash your hair. We'll stop all that for the first 10 days, okay? We limit the activities to deal with your hair, okay? But the physical activities, elsewhere you can go on with your normal work, okay? As long as you're not exposed to too much sunlight.
However, there are some side effects to this process, but Dr. Nsubuga says these are not threatening.
Someone did ask me whether actually this causes cancer. No, hair transplants don't cause any cancer. They're very safe because we're using your own DNA, you're using your own hair, so we cannot have any cancerous cells in there. Unless you already have a cancer that is being developed, but we haven't had such cases, not even in research. And one side effect that is very common, okay, and which wears off within a few days, I would say a little bit of facial swelling. But we have devised medications that actually protect you from that. Because of the drugs we give, your face may swell for a while and then it subsides within a few days.
For this kind of treatment, you will have to part with about 6 million shillings. But normally, that is for a wide bald. Pricing, according to Dr. Nsubuga, is dependent on your condition.
The procedure can be a one-day procedure, depends on how big the surface area is, because we have found some people having a huge surface area and we end up doing it like in 2 or 3 phases. That is the surgery itself. So it may take around 1 year to 18 months, okay, to have fully grown hair. But of course, every month you're seeing a difference.
To prevent hair loss, you are advised to eat a nutritionally balanced diet, avoid tight hairstyles such as braids, bands or ponytails, avoid compulsively twisting, rubbing or pulling your hair, treat your hair gently while washing and brushing, and avoid harsh treatment such as hot rollers, curling irons, hot oil treatments, and permanents. Walter Mwesije, NTV.
Thank you.